the basics of the results. My advice on people who want to learn about research and statistics is, I would say to my students that medicine plus statistics is equal to research. And this statistics is not a hi-fi mathematics out of the 12th standard mathematics. I would say not even 5% is required for statistics needed for medical research. Even less than that only. We have studied differential calculus, integral calculus and all. So much tough concepts we have passed into it. And the statistics which we are using is very, 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 very simple. Only thing is, over time, we have developed aversion towards mathematics. We have developed aversion towards numbers, calculations. Many people feel it's not our cup of tea since we have landed up in medicine. We have nothing to do with mathematics. But this very little mathematics will add value to your research, and it will definitely transform your life. Why I am saying this is, if you have any bit of negative mindset about statistics, please take out at least for the next 20-25 minutes. With that, I'll go into on the results. As I said, in your questionnaire, you have different questions. Each question will become a variable. Suppose, let's say, age will become a variable. Gender will become a variable. Occupation will become a variable. Height will become variable. Weight will become variable. Sometimes two variable will combine to make into one variable. I said height and weight are separate variables. Height and weight will make into a BMI as one variable again. Likewise, you get many variables, or each question will become variable, and combination of these questions will also become a variable. So variable means basically one parameter which differs from one person to another person. So let's say blood group is not same as the other individual, then that will become a variable. So as simple as that. There are different types of variable. We have this numerical and categorical. Broadly, it is divided into, for statistical calculation purpose, you need to remember it as numbers and categories. Age is the best example for numbers. Gender is the best example for the category. In medical terms, hemoglobin is a numerical variable. Anemia present or absent is a categorical variable. In such way, you can remember. Under numerical variable, we have continuous variable, discrete variable. That is, continuous means 16.5 will be there. But discrete means total number of family members. There will be only 5. There cannot be 5.5, 5.25 and all cannot be there. So that will be a discrete variable. And categorical variable again divided into ordinal and nominal variable. Nominal means they are just names. You have to remember that way. Name, like blood grouping, is a name. You cannot say B group is superior when compared to A group, or O group is superior when compared to A group. That you cannot say. So there is no rank order in blood grouping. So that is simply a nominal variable. On the other hand, you have mild, moderate, severe, grade 1, 2, 3, 4. Those things have a rank order. Student with the different grades of marks, that will be considered as a rank order. So that is called as a rank order or ordinal variable. So you forget about this lower base, and for statistical purpose, we are going to deal with this numerical and categorical variables. Again, these are all the types of variables. As I have mentioned, categorical variables otherwise called as qualitative variables. Numerical variables are otherwise called as quantitative variables. We have interval and ratio that right now we don't have to focus on it. As I said, you remember quantitative or continuous variable, qualitative or categorical. Okay, here are some of the examples which I have mentioned, which is in weight, blood group, all those things which I have mentioned. In statistical plan under methodology, I have mentioned the same picture. I want to remember this slide for results. So all your statistical methods will be divided into descriptive statistics and inferential statistics. Descriptive statistics will be based on categories and numerical variable. If you have gender, if you have blood grouping, if you have anemia present and absent, you have to put it in categorical. If you have numbers like height, weight, BMI, hemoglobin, age and all will be in numerical variable. That is your descriptive statistics. If it is a categorical variable, you need to summarize and visualize. For summarizing the categorical variables will be through the tables and frequency. We will show in the next slides. And visualizing can be done by pie chart and bar chart. We will see in the coming slides what it is. The same way, numerical variable can be summarized using mean and standard deviation or median and interquartile range. Here we have this visualization by histogram most commonly. And inferential statistics, we have two types. One is the estimator of the parameters, and another one is the calculating the p-value. I want you to know about the descriptive statistics. We have smoking status, yes and no. So this is called as a simple table, one-way table, where we deal with numbers, percentages, and overall total will be here. Numbers, exact numbers are the frequencies, and percentage will be present here. So this will be the one-way table. And how are we going to visualize this? Yes, no, smoking status will be like this. So we will be visualizing like this, and you can insert colors like smoking. Yes means you can put up as a red as a danger signal. So 32, that is frequency percentage, you can put it in a pie chart. You need to have a proper title for a pie chart visualization. You need to label it in present percentage, and you need to put the total number of subjects also. This you do when your category is only two. But when your category is more than three, you cannot have this pie chart. Otherwise, your pie chart will become so much crowded. It will not give the exact meaning what it wants to convey. So in that case, you have four categories means better you can go with the bar diagram. This is called as bar diagram, where you have x-axis, you have the levels of variable, and your y-axis will have the percentage or the frequency. Here the axis title you need to mention, you need to data label it, you need to give the proper title. All these are all the basics of the bar diagram. This is the visualization method for a categorical variable. That is any outcome with a category. Here you can put up any ordinal variable also in the bar diagram. And when you are dealing with tables, so far we have seen simple one-way table, and now we move on to the multiple or cross tabulation. When we are doing inferential statistics, these cross tables or multiple tables will be needed. So here you are looking at how gender and smoking status are associated. So male and female, we have frequency and percentages. We put up table like this. We have outcome variable and factor variable, number, percentage, row column and column total will be present. So how to visualize this data? We can visualize by multiple or adjacent bar diagram, where we can put up the number of males and females under each diseases like this. So which is a comparison based on the gender. So this is the bar diagram. How are we going to summarize the numerical variable? That is by the mean and standard deviation. If it is not normally distributed, then we go with median and interquartile range. We will describe about what is normal distribution. This is the variable, age is your variable. If it is distributed like this is somewhat like a bell-shaped curve. So you can consider more or less it's a normal data. If you are making a bar diagram without no separation between the bars, that is called as histogram. So where are we? We are in the representation of the data, statistical methods, descriptive statistics, and inferential statistics. We have seen the categorical and numerical, summarization and visualization of categories, summarization and visualization of the numbers. Under inferential statistics, we have this estimation of the parameters, where we see based on our study results, we look into the compare it with the population parameters. Either it can be a population, how far it is good for with the population. And we have hypothesis testing. That is, if we are looking at two parameters, two variables, let's say smoking and gender, if we are looking at any association, then there is a parameter of association, that is whether the two parameters are associated or not will be identified using the p-value. Again, what is p-value? It's a big topic again. Right now, you understand p-value is a parameter which identifies the significance of association between two parameters. In real scenario, you would have entered the values like this. I am going to identify the variable. Somebody can tell me what is this variable, categorical or numerical variable?
Categorical. Gender is categorical.
Categorical variable. Yes, correct. Gender is a categorical variable. So how to represent this? Any idea? Summarizing is by the table, and visualizing?
We can do it by pie chart. Pie would be best.
Yeah, pie would be best because your outcome has only two, that is male and female. Again, you can put the frequencies, title, total number, frequency, percentage, and male usually blue, female like that, you can decorate it. We move on to the next parameter. And now identify this variable. What is this variable? Categorical or numerical?
Categorical.
Again, this is also a categorical variable. So how to represent this?
Bar will be better.
Bar will be better because your outcomes will be more than 3. Outcomes are more than 3. So bar will be better. Again, you have the socioeconomic status in the title. The frequency is here. So bar will be better. Okay, that's what we have done. Now, again, identify this variable, whether it is categorical or numerical.
This is numerical.
Numerical, yes, very good. Since hemoglobin is a continuous variable or a numerical variable, hemoglobin we have summarized with mean and standard deviation. Standard deviation. What will be the visualization? How it can be visualized?
Bar chart or histogram would be good.
Actually, bar chart is for categorical variable only. So better will be histogram. We have frequency, hemoglobin, and your normal curve will be present. Now identify this variable, whether it is categorical or numerical.
Categorical.
Yes, presence of anemia is a categorical. How will you represent it?
Bar chart.
Pi.
Pie chart.
Pie chart. Don't get confused because it's an outcome variable, present and absent. So we have different way of to represent it. That is pie chart. Oh, now we are all clear with the descriptive statistic. Now we move on to the inferential statistics. When we are looking at inferential statistics, we are going to study association between two variables. Most commonly, when we are looking at association, we try to put up one dependent factor and one independent factor. This independent factor is called as predictor factor. The dependent factor is called as the response factor. The variables can be further classified into dependent or response based on the primary interest. Your BP in an antihypertensive trial will be a dependent or response variable. It's a dependent variable not controlled by the experimenter. The other variables such as age, gender, and all will be an independent or predictor factor. It's called as a factor when controlled by the experimenter. It is often nominal. The treatment which you are giving will be an independent factor. And before going to the inferential statistics, this is slightly simple basics. As I told, you need to understand when does you call a variable is normally distributed. This is one small assumption only. You don't have to worry about what is normal distributed curve and all. If you put a histogram, you get a bell-shaped curve that is called as a normally distributed variable. That's all, very simple. What is a normally distributed variable? When you put up a histogram of a continuous variable, if you get a curve, normal curve as bell-shaped like this, then it is a normal distributed curve. In reality, you will not get exactly like this. So there will be bend here and there. So in that case, you need to apply some other criteria for that also. Right now, you don't go into deep into that. But why this normal distribution is important is after applying the test for the normality, if you identify it is a normally distributed parameter, then you need to apply parametric test. If it is not normally distributed variable, then you need to apply non-parametric test. That's all, very simple. You need to remember there are certain criteria to identify a numerical variable, whether it is normally distributed or not, you need to identify. And if it is normally distributed, you need to apply parametric test. If it is not normally distributed, you need to apply a non-parametric test. As simple as that. And this is one flow chart for the entire inferential statistics. When you are dealing with a continuous variable, categorical variable, as exposure and outcome variable, what will be the statistical test? If the recordings are available, you can take a snapshot of it. So this is one place where you have to tell what statistical tests need to be applied under different conditions. Again, we have one more type of research that is called as paired samples. That is, many of the times we have before and after observations. Before marriage and after marriage, like this, how it is shown in this picture, we have paired samples, that is before and after observation. So there are also different types of statistical tests are used. You just have to remember the name of the test. The basics remains the same. You get a p-value. You are not going to do this statistical test as a. The only thing is you need to understand under what circumstances this test to be applied. Majority of the tests will yield results in p-value only. And that p-value is the significance, and most commonly accepted level of significance is 0.05. So less than that is significant, more than that is not significant. So these are all the tests for paired or matched observations. These tests you don't believe in your memory. I won't recommend memorizing this statistical test unless you are a community medicine postgraduate. Otherwise, no need. You boldly say, I don't know, and Google is there to help you. If you put up statistical test for continuous independent variable and categorical dependent variable, automatically the test which is needed should appear. This was taken nearly 6-7 years back. Nowadays, so many AI have come. They will tell you exact test to be done, and you can cross-verify with flowcharts. Now we are going to use this statistical test, inferential statistical test. Same way, we are going to find, is there a relationship between gender and anemia was our question. What is this? This is a comparison of category versus category. So you need to cross-tabulate it like that. Don't worry about p-value alone. There are many formalities before p-value to be done. And one of the important formality is the cross tabulation. You need to make it correctly. Outcome variable should be here and your predictor variable should be here. So predictor variable is gender here, outcome variable here. Put up the cell values frequencies correctly, in percentage also correctly. Then you need to apply the statistical test. Here the test of choice is chi-square test for the two categories. Most of the undergraduate community medicine classes, you would have dealt about chi-square test with the 2/2 table. So here we have to apply chi-square test. We have found out the p-value as 0.06, which is not significant because p-value is 0.05 is a significant level. And here is one more test of here we are going to find out whether there is a relationship between a categorical variable and a continuous variable. So that is gender and hemoglobin. So this is a comparison of category versus numerical variable. So we are going to compare the numeric value or compare the means between two groups. For that, we are supposed to use, can anybody guess what is the test we are supposed to use here?
T-test.
Yes,
No.
it yes. It is student t-test or independent t-test. And if you have any confusion, no need to worry. You can cross-verify. We have identified p-value as 0.439, which is also again not significant. Okay, now we are going to identify the relationship between socioeconomic status and hemoglobin. It is wrongly written here. Don't see this. It is a category and numerical variable. Your class's outcomes are more than 2. Okay. So we have more than 2. We all know t-test is for 2 comparison of 2 means. So more than 2 means what will be the test? Yeah, most commonly ANOVA. I think people who are answering will be somewhere from community medicine. So ANOVA is the test of choice here. And don't worry about what is the test of choice here. You will get a p-value like this. You need to infer properly. Okay. And you need to know under what circumstances what test to be used. You get the p-value. You need to see whether it is less than or greater than 0.05. So again, that is also not significant. Now we are going to compare age and hemoglobin values. That is these values. It is a comparison of two numerical variables. So we will put up like this. What is the test of choice here? Can anybody tell what is the test of choice here? Comparison of two numerical variables. It is the correlation test. Depending upon the type of variable, we have Pearson correlation, Spearman's correlation, Kendall-Tau correlation and all present. So correlation is a test of choice when you compare between two numerical variables. As simple as that. All these are all called as bivariate analysis. Now we are going into the multivariate analysis. Under inferential statistics, in statistics, we have seen descriptive statistics. We have started describing about categorical and numerical. We summarized it, visualized it. Under inferential statistics, we have seen the bivariate analysis. Now we are going to see multivariate analysis. For that, the most commonly used thing is the regression. In one single line I have to explain means how much one variable or factor predicts the other. Previously, what we have seen was association. This model is little complicated, but you don't have to go into the model per se. But what it says is how much age influences your hypertension, blood pressure. For each and every year increase in age, how much BP increases. If you find out that is through the regression analysis only. So comparison of multiple independent factors in one model can be done. We also can do one-to-one, that is called a simple regression. Many-to-one, that will be multiple regression. We have linear regression, logistic regression. Linear regression, when your outcome is continuous, when your outcome is categorical, you call it as logistic regression. So these are all the terms which you use, but right now you remember when you predict one variable from the variable from your study, that is called as regression. Now we move on to a significance. That is what we so far we have seen is the statistical significance, which is the best significance. You have to understand what is the concept of clinical significance also. And to end up, this is a more for your results. So data should answer your objectives. As I told earlier, one line which you always remember in each and every step is your objective. So when you are representing your data, you should remember your objective. Some variable which is not at all related to your objective need not be represented, need not be included, just because simply because you have collected in your data. Don't try to do the results for that also. I said right representation of data will be descriptive and inferential statistics. and select the right statistical test. Always ask for help and make self-explanatory figures for your results. Then understand about significance. We have two types of significance, clinical and statistical significance. Whenever you get p-value more than 0.05, don't feel that game is over. It is also a finding. When you don't find a relationship between two variables, really there may not be a relationship between those two variables. Don't go beyond the significance or the p-value less than 0.05. And most importantly, the most dangerous of all falsehood is the slightly distorted truth. Never try to manipulate your study results. You should keep in mind when you are doing the results. Now, this is the entire glimpse of the results. So, descriptives and inferentials, categoricals and numerical, summarizing and visualizing, estimation and hypothesis testing, 1-to-1, many to one also is there. And to end up my presentation, here is one advertisement. Many of you know about my YouTube channel, and it is exclusively for research, and some videos are for community medicine also. So you can subscribe to my channel, see the BCBR videos also. There are 3 parts for BCBR.
Thank you so much for the brief explanation, sir. Actually, this is a vast topic, but you cover all the topic in concise manner within 1 hour, sir. Well understand the concept by us.
Yes, thank you, ma'am. Thank you, ma'am.